Can you share some memorable experiences from your mission in Ukraine and, of course, Nepal too?
Before leaving for Ukraine, especially the first two times, we were really scared because you go there and sometimes you hear the bombings. Like sometimes you're going to sleep and after a while all your phones just start ringing because there is an upcoming bombing and you need to run down to the shelter. And when you're down in the shelter, you hear the explosion all over you. So it was very hard, but every time we finished one of these courses, the people we were teaching to, that were doctors and nurses almost of our age, they were coming to us, hugging us, and thanking us for being there and having left the safety of our homes in Italy to be there with them, to share the pain and the stress, to share the knowledge, because as we taught them, we received also a mixture of really scary moments and also really satisfying moments in hugging these people and sharing these moments with them.
Hello viewers, I'm your host Charanpreet Bagga and I'm thrilled to bring you this exciting episode of the Indie Talk Show. Today we have a remarkable guest with us, a 32-year-old doctor, Dr. Giovanni from Italy. Thank you for coming to the show, Dr. Giovanni.
Very much.
Can you tell us a bit more about your background and what led you to pursue a career in medicine?
All right, it's a very interesting story. I come from a small city in Italy, very close to Milan, that has also a very historical university. At first, I didn't want to do medicine, but while I was finishing my studies in high school, I felt a lot of passion for scientific subjects, like biology, chemistry. And so, preparing for the admission test in university, I fall in love kind of with medicine. Not because since I was a kid I was trying to help people, but because I really love to know how the human body works. It is probably the most complicated machine on earth. So I really felt curious about studying what is going on in our bodies.
Growing up in Pavia, which was a very small town in Italy, how did your environment and upbringing influence you to such a career choice?
This is a very interesting question because it is a very small village, especially compared to other major cities, but it's very close to Milan. So anytime you want to go to the big cities, half an hour by car you're there. And all the north of Italy, it's all packed together. So if you want to go to the mountains or to the sea, it's very close. So whichever interest you have for nature, wilderness, or sports, it's right there. And also probably it helped also my career because it has this important university and I stayed there. I stayed in the same city I grew up. I did university there, and by doing that I also lived with my parents during the university years, saving a little bit of money. And this of course gave me more opportunity to develop projects and interests.
So you did your studies from Milan.
I did my studies in the University of Pavia, that is this city very close to Milan, and it's probably one of the best medical universities in Italy.
So I would like to let my viewers know that Dr. Giovanni here is the president of Italian Society of Extreme Environment Medicine. Dr. Giovanni, what are the most challenging aspects of your role?
Very interesting and very difficult at the same time covering this role because you're doing something you're really passionate for, but there is also a lot of paperwork and bureaucracy to do in order to keep a society up. So we are a group of passionate researchers, doctors, nurses, technicians who loves medicine and rescue applied to difficult environment like rescuing the mountains, at sea, humanitarian missions. And our goal is to bring all these people together, to work together, to do research projects together in order to improve what we know about medical emergencies in this context. So it's very demanding sometimes to work in all these kind of fields, but it's also very enriching and satisfying experience.
What are some of the unique challenges faced by doctors working in extreme environments and how do you prepare for them?
If you want to be of help during an expedition in whatever context is a war zone or you're doing a mountain expedition, you need first to be physically prepared for it, physically and mentally prepared for it. Your medical knowledge comes after that. Because first of all, you need to be able to keep up with the expedition, to the environment and the climate you're staying in, and not to fall sick, not to injure yourself. So you need to be very professional about the expedition setting. After that, you need to also be a good medic in order to help each other. But first, you need to be ready physically and mentally to be part of an expedition that maybe is staying for 2 months at sea or is attempting the ascent of one of the leap mountains we have on the world. So I would say, first of all, being physically and mentally prepared.
So, what I'm trying to understand from my knowledge here, that you also need to be mentally prepared and physically prepared.
Yes.
More of a physically prepared for a mountain expedition, or you should know how to do mountain climbing or stuff like that, right?
Exactly. Like if you want to take part for a mountain expedition as a medic or as a rescuer, first of all, you need to be a very, very, very good mountaineer, even before being a good doctor or a good paramedic. So first of all, you need to train a lot for being one of the best mountaineers in the group.
So, have you climbed any mountains or have you climbed any peaks?
Yeah, so far, yes. We are so lucky that we live in Italy, very close to the Alps. So you have this huge amount of beautiful peaks with different difficulties and challenges that you can climb in summer or in winter with ice axes or with ropes. And so, yes, me and my friend usually spend our weekends in climbing our mountains. So we say that we are prepared for the things we're talking about. And also, we already conducted many medical researches as high altitude. So on our highest mountain, like Mont Blanc, that is one of the highest mountains in Europe.
You've done that?
Yes.
Okay. And how long were you there for?
We were there for a couple of days, and we did multiple, let's say, small expedition there to test medical equipment in preparation for something that we are planning right now.
So, when you do an expedition like this and you follow a group of people and one of them falls sick, and are they airlifted?
Depends if
And you guys travel with them? I'm sorry, I'm cutting the conversation.
no worries. It's a very interesting things that you are asking. Luckily, never happened, but in Italy we have our emergency system and mountain rescue that provide heli rescue. It's also for free. We have public healthcare, and if you're injured in the mountain, if the weather is okay, you are airlifted to the nearest hospital.
And you travel with the
Not in this case. So, as talking about Italy, you have already doctors on the helicopters that comes and rescue the injured person, and so they fly with them.
where does your role come into play?
When we plan this expedition, we do it for research. So during the whole expedition, we try to prevent this kind of things. So we plan an expedition accordingly in order not to have all the diseases that can happen at very high altitude. We have medication for that, and of course, we ensure that all of us are trained and we want to avoid these kind of injuries.
Can you tell us some more about the Global Medical Trainers Project?
All right, that is a non-profit project that me and my colleagues started because we really like to teach about first aid and medical courses. We've been doing that since we graduated to teach people, civilians, how to do cardiopulmonary resuscitation on the street, and also to young medical students, young doctors and nurses how to perform some procedures. And this project happened by chance when the war in Ukraine started, and we were requested to do some first aid courses to the military personnel and the doctor there. So what we did was start in planning expedition in the places where we're asked to provide medical courses. And we're doing this entirely for free. So we're doing this in our free time, but also because with financial support from some organization like Rotary International. And so during the past years, we conducted 4 expeditions in different areas of Ukraine with the aim of providing medical courses for free. And lastly, actually, a few weeks ago, I was in Nepal for delivering a first aid medical course to local people in collaboration with the Nepal Mountaineering Association, and raising awareness and teaching them how to recognize and treat high altitude medical pathologies, because all these people work at very high altitude, so there is a high chance that they see either their clients or themselves getting affected of these deadly pathologies. And so we elaborated for them, we designed for them a specific course on recognizing these pathologies in this very peculiar extreme environment.
Can you share some memorable experiences from your mission in Ukraine and, of course, Nepal too?
All right. Uh, this is a very touching question because, uh, first of all, I get to say that before leaving for Ukraine, especially the first two times, we were really scared because you go there and sometimes you hear the bombings. Like sometimes you're going to sleep, and after a while, all your phones just start ringing because there is an upcoming bombing, and you need to run down to the shelter. And when you're down in the shelter, you hear the explosion all over you. So there have been very scary moments for us. Uh, it was very hard, but every time we finished one of these courses, the people we were teaching to, that were doctors and nurses almost of our age, they would come to us and say thank you, even though we didn't feel we needed a thank you, but they were coming to us, hugging us, and thanking us for being there and having left the safety of our homes in Italy to be there with them, or to share the pain and the stress, to share the knowledge, because as we taught them, we received also some view of how they're doing things there. So uh, it was a mixture of really scary moments and also really satisfying moments in hiding these people and sharing these moments with them.
Okay. How did you become involved with Sea Shepherd?
All right. Sea Shepherd is a wonderful organization to which I'm really dedicating a lot of my free time. Everything started almost 10 years ago when I started scuba diving by chance. And the first time I scuba dived, I felt amazed about all the life there is underwater. I never thought there would be so many colors, so many creatures with these different shapes underwater. And as you fall in love with something, you want to know more. And by knowing more, I also discovered there is a lot of damage that humans are producing to the ocean. And so I was looking also for an organization that we was defending the oceans. And Sea Shepherd is probably the main organization that is attacking and fighting illegal fishing all over the world. So that was during my university times. After I became a doctor, I applied to be on board the doctor for their ships and their campaigns all over the world. And so that's how I started working for them.
Okay. You happen to mention that many people doubted your choice to study medicine and specialize in emergency medicine. How did you overcome these doubts?
Thank you for these hard questions. So, since I was a kid, I've been very distracted and wasn't able to focus very much on anything. So there was some concerns from my family, from my mom, that maybe medicine was not hard for me because probably I wouldn't have been able to spend days and days and days and nights studying on the books. But I decided that I was interested, I was curious about it. And when I get curious about something, I want to learn more about something. And this probably is what kept me pushing in medicine. The first 2 years of medical schools were hard, but actually they paid off. After a while, I was able to enjoy actually medicine. Like it was okay to spending the nights on the books because I was really interested and passionate about it.
Basically, you were passionate about
Yes, yeah,
medicine and especially environment.
that is the only reason why I made to get a degree, because I really loved it. I was really curious about the scientific aspects of medicine, and so that is what kept me and brought me to finishing my medical studies.
But, I'm sure you must be very good scuba diver and a mountain climber. How did you balance your life between these two and your your study in medicine?
I sleep very little. That's probably the short question. It's sometimes it's hard to mesh everything, but it is. Yes, actually, I sleep very little and I combine everything. So when I finish a shift, maybe a night shift, I manage to go to the mountains. but maybe that means that I'm sleeping few hours at night. I'm combining projects, so sometimes if we uh, want to go to the mountains, we do research in the mountains, so we combine our passion for medical research in mountains, so we get to spend times either in the mountains or in the water while we are doing the research. So we are combining together our passions.
As far as I know, as Indians, as Indians basically, is that 8 hours of sleep is a must for your body to grow, for your mind to rest, and be fully activated. And less than that could hamper your body, even lead to heart attack. Is that right?
So we Italians believe the same as Indians. So 8 hours, it's a healthy amount of hours to sleep. There is no denying that. And yeah, me and most of my colleagues that have all these passions and have long shifts in the hospital are sacrificing a little bit of our sleep. And that's it. Like there's uh, no pros of it. Like we're sleeping too little for what we're supposed to do, and but we're doing that because we love too much what we're doing, both at work and outside the hospital.
Knowing that it might damage your body.
Yeah, yeah. Like it's a thing like people smoke and drink alcohol knowing it's a harmful thing. We're doing this knowing that is a harmful thing, and we're aware of that. But we love too much working in a hospital and having these passions in the mountains. And let's see, probably spending this time in nature and the wilderness in the mountains is probably itself a medicine for us to relieve from the stress and all the bad things we see in the hospital.
So it's not a passion; it's your obsession towards your work. You're obsessed.
It's for sure a passion. I don't know if it is an obsession, but what I believe it's probably is also medicine that helps us relieve all the stress and detach from all the human problems we see every day.
Are there any new projects or initiatives that you are excited to share with us?
So we are now planning. These are the last weeks of planning of a massive expedition we're organizing in Argentina. So me and my colleagues are testing new products for treating high altitude diseases. We already conducted these studies on the Mont Blanc, and we're planning to ascend the highest mountain in South America that is called Mount Aconcagua. And this mountain is almost 7,000 meters. So it's very high, and this gave us the chances to study more about human physiology and try these devices and see if these can have a massive impact for future treatment of this pathology. So now we're basically focused all on this expedition, preparing all the materials, studying the path to ascend the mountain, and preparing all the research studies we will conduct in Argentina. So we are really excited and at the same time also terrified about this experience because we know that going high is dangerous. But we're training for that. We've been training for years for this kind of scenario. So we're very excited about it.
You are setting up in collaboration with Dr. Lokean Budgupta, who's head of emergency medicines and also the president of sector in India. You're setting up a department of extreme medicine. Do you somehow, now that you visited Vedanta, you've been here, how do you compare the emergency services in India?
So I was very impressed while visiting Medanta Hospital because it's impressive structure and impressive facilities with lot of healthcare workers, lot of services. So I was very happily pleased to see this infrastructure, and I was also happy to have this opportunity to visit this place, visit this part of Indian healthcare, and of course to start this collaboration with Dr. Lokendra Gupta because it gave me the opportunity to have a glance of his reality of his emergency room, meeting his team that is a wonderful team, and maybe starting this project. So try to find a common ground on which we can elaborate how to improve the research and understanding of pathology of extreme environments in India. And we need also to consider that extreme environments, we don't need to go far away from hospital because the climate is becoming more extreme year after year. So cases of heat stroke, heat-related problems, we're gonna see more and more. So it's very important for clinicians all over the world to be more aware and be able to treat all these pathologies. So I had the impression that Medanta is a very dynamic reality with a lot of potential, and they want to get better wherever they can. And so I think that if they want to improve some aspects of their project, of their departments, they for sure they are doing that. Like for example, our Kendra reached out us in Italy for developing studies on extreme environment medicines.
I was in Milan in 2012 and I felt sick, like really sick. I had back flu and cough, and I don't remember the name of the hospital. It was a little far from where I was staying in downtown. So me and my wife, we went to the hospital, to the emergency department, but it took me one entire day. So we went at, I think, 9:30 in the morning, and it took me the entire day. By 5 o'clock, I could meet a doctor and get my medication. I personally think that's not a time that was, taken for an emergency department to treat a patient.
I totally agree with you, and unfortunately, is not an uncommon thing in Italy. And this is not because the doctors over there are not working, because they're working a lot, especially the doctors and the nurses and the technician in the emergency room are working probably more than any other specialty doctor in the hospital. The problem is that we are overcrowded with people, and there are not enough doctors in our emergency room. There are not enough nurses in the emergency room, and the government is not improving the resources, is not putting more people to work there, and so all the healthcare professionals are working so much, so hard to face this huge amount of patients. But even if they work very hard, unfortunately, it happens for many people like you that they have to wait so many hours to get visited and to get accepted, and also maybe to get examination or operations. It takes months for being in a list for some kind of operation, and this is unacceptable. But the Italian government, like many governments around the world in Europe, for that have public healthcare, that are not investing in public healthcare, that are not paying more for having more doctors and more nurses in the critical care departments, makes these terrible things for people waiting so long, and this is unacceptable.
How can our listeners support your work or get involved with your projects?
Thank you. So we're very active also on social media and our association, and we often advertise when we're doing a project where we want to involve people, either by participating in our studies, that can be being in the mountains with us, being at sea with us, or simply also replying a survey from your laptop. So everybody can help us also from distance. So just to follow us and see our projects and spread the word of like all these pathologies that we're discussing about. They can also being part of a positive movement in developing their own non-profit projects. Like the project we started in Ukraine and Nepal was started entirely by us. If we can do it, everybody can do it. So if anyone has the will or wants to do a non-profit project, want to do an improvement in their community, to start planning for it. If they want a change in their neighborhood, they should do it. And because they have the power to do it. And so why not start by today?
So for people who would like to follow Dr. Giovanni journey and expeditions, there's a link on the screen. Just have a look at it. Thank you for coming to the show, Dr. Giovanni Cappa. It was nice to have you there.
Very much.
Don't forget to like, share, subscribe, and hit the bell icon so that you don't miss an episode of the AV Talk Show.